Welcome to Exploring the Roots of Energy. It's the podcast where we unravel the complex science behind health, energy, and longevity into simple, actionable insights. I'm Marco Lane, your host, and I'm here to break down the ideas that connect the dots between metabolism, hormones, and overall vitality. Today's episode dives into an incredible discussion on androgens like DHT and stress hormones, particularly cortisol. We're breaking down a fascinating podcast by Georgi Dinkov and Roddy, which explores the bioenergetic principles rooted in Dr. Peat's work. I'll simplify their insights, translate the science, and help you walk away with practical takeaways. So, grab a coffee, tea, or whatever fuels your curiosity, and let's get started. Segment 1, the basics of DHT. Let's start with DHT, or dihydrotestosterone. It's a potent androgen, essentially a male steroid hormone that plays a critical role in muscle mass, vitality, and overall health. For years, medicine painted DHT as the villain, linking it to prostate problems and hair loss. But as our speakers discussed, recent research, and even Dr. Peat suggests that DHT may be one of the safest and most effective androgens to support male health. In fact, DHT has shown remarkable results in reversing frailty, improving mood, and even helping with chronic kidney disease. One study even showed that supplementing with DHT could reverse advanced kidney dysfunction, equivalent to what we'd see in dialysis patients. Here's the key takeaway. DHT appears to be not only safe when used appropriately, but also highly beneficial for restoring vitality in aging men and potentially protecting against chronic illnesses. Segment 2, testosterone versus DHT. One question often raised is, why not just use testosterone instead of DHT? After all, testosterone is the more well-known androgen. The reason comes down to its conversion into estrogen. Testosterone can aromatize. That means it can be converted into estrogen by the body. DHT, on the other hand, doesn't convert into estrogen. This makes it a safer option for individuals dealing with estrogen-related issues, such as high prolactin, chronic stress, or conditions like breast cancer. Interestingly, DHT has even been studied for its anti-cancer properties, particularly for hormone-driven cancers. What's important to remember is that hormone therapy, whether with DHT or testosterone, should always be approached with caution and ideally under the guidance of a healthcare professional. The body's hormone balance is delicate, and one-size-fits-all solutions rarely work. Segment 3, the role of cortisol in chronic illness. Now, let's switch gears to stress hormones, particularly cortisol. As discussed in the podcast, cortisol is often overlooked as a driver of chronic illnesses like type 2 diabetes. Most doctors don't immediately test cortisol levels in diabetic or pre-diabetic patients, despite clear evidence linking chronic stress to elevated blood sugar levels. Here's the mechanism. When cortisol levels are high, the body ramps up gluconeogenesis. Basically, it creates glucose from non-carbohydrate sources like protein. This process is meant to be a short-term survival mechanism, but if it becomes chronic, it leads to insulin resistance, muscle loss, and fat gain. Essentially, the body's metabolic balance is thrown off. The podcast also touched on a fascinating treatment approach, blocking cortisol to manage these conditions. For instance, the drug RU486, originally developed as a cortisol blocker, has shown incredible results in reversing hyperglycemia and even depression. The takeaway? Chronic stress isn't just a mental health issue, it's a metabolic one. Addressing cortisol levels, whether through lifestyle changes, supplements, or medication, is crucial for long-term health. Segment 4, practical takeaways. So, what can we learn from all of this? Here are some actionable points. 1, for androgens. If you're exploring testosterone or DHT supplementation, work with a healthcare provider. Low testosterone or DHT levels can impact energy, muscle mass, and overall vitality. These hormones aren't villains, they're tools when used appropriately. 2, managing stress. Keep an eye on your stress levels. Chronic stress raises cortisol, which can drive insulin resistance, fat gain, and even immune dysfunction. Practices like meditation, exercise, and proper nutrition can help regulate cortisol naturally. 3, nutrition and hormones. Eating a balanced diet rich in carbohydrates and proteins supports hormonal balance. For instance, carbohydrates are crucial for lowering stress hormones by supplying glucose to the liver for glycogen storage. 4, supplements. Supplements like pregnenolone, progesterone, and niacinamide a form of vitamin B3, can help regulate stress hormones and improve energy metabolism. Again, these should be used thoughtfully and with guidance. That wraps up today's episode of Exploring the Roots of Energy. We've covered a lot, from the misunderstood benefits of DHT to the overlooked role of cortisol in chronic disease. Remember, understanding these systems isn't just about managing illness, it's about optimizing your vitality and longevity. If you found this episode helpful, subscribe, leave a review, and share it with a friend who might benefit. And as always, stay curious and keep exploring the roots of energy in your own life. Thanks for listening.